Well, flu is not the only illness filling up local hospitals right now. Children's Hospital is seeing lots of young children with RSV. WATE 6 on your side anchor Lori Tucker is here tonight with Caring for Our Kids.
Yeah, Jill, RSV is highly contagious. It can be especially dangerous for babies. The Centers for Disease Control reports that 1.5 million children are treated for RSV every year. More than 150,000 have to be hospitalized. So joining us now with more on this so you can make sure your kids try to prevent it is Dr. Ryan Redmond, ER Director at Children's Hospital. Always good to see you.
Well,
Let's start off with this. What is RSV?
So RSV is one of the more common viral infections this time of year. In adults, it's usually one of the more common reasons that you get a cold over the winter. But in young kids, it can be more problematic, especially when you look at that group under 6 months of age.
We know it's highly contagious. How is it spread?
So it is spread mostly by droplets, so sneezing, coughing, especially if you got runny nose, wiping on your hands. So that's why hand washing is so important when trying to stop the spread of this disease.
And that's why it runs through daycares, schools, that kind of thing. Signs and symptoms that we parents need to look out for.
So the basic ones are going to be your kind of fever, cough, runny nose, which of course is pretty ubiquitous this time of year.
Right.
All kids are running around with some kind of snotty nose. But the important thing is to realize that when you're having trouble with feeding or you're having trouble with work of breathing, especially in the younger kids, that's the time to seek medical care.
My nephew had this when he was a little guy, maybe 2 years old, and that was the thing, the struggle to breathe. That was so scary. There are complications here too if you're not careful.
There certainly can be, and that's usually the biggest reason that kids need to come into the hospital is to get extra oxygen or to help with feeding. We've tried a whole bunch of different things, over the years when you look at, things like steroids and things like breathing treatments, and we really wanted all those things to help, but we've really found that the key is supportive care. So we've really taken a step back and said, let's treat it supportively. That's going to be what gets kids through it, and especially even the really sick ones.
Wow, just keeping the child as comfortable as possible and letting the body fight it?
Exactly, and this is one of those, again, infections that doesn't respond to antibiotics because it is a viral infection. So it's all about keeping the kids comfortable and hydrated and oxygenated till they can get through it themselves.
All right, final word, really quickly, to prevent it. Once again, wash
Absolutely.
those hands.
It's all the bread and butter stuff of good hand washing and keeping kids who are sick apart from especially small infants.
All right, doctor, thank you so much. We appreciate it as always. And if you have a question about your child's health, just email me at ltucker@wate.com. And be sure to tune in every Thursday here on 6 News at 5:30. You never know, we may use your question on the air.